let's talk about enhanced goal clarification. As we have and will continue to stress throughout your CPE experience, effective communication is the hallmark of effective chaplaincy. One aspect of effective communication is the ability to clarify goals. Every setting in which you may serve as a chaplain will benefit from your increasing ability to clarify goals. But the clinical setting presents the most intense need for this skill. Every day, people are faced with the need to make decisions that impact their life. In clinical settings, decisions must be made about medical treatment for whatever ails them. The imperative for medical professionals in the biomedical ethics principle dictates that the patient oversees their own medical decisions. The patient gets to be in charge of their medical treatment. These decisions belong to the patient alone, or if unable to make competent decisions, then it falls to the healthcare proxy or the healthcare power of attorney. They become the delegated decision maker on behalf of the patient. The real problem with this is that the patient, their family, and their proxy simply do not know what the medical team knows. And to make it more difficult, they are faced with emotionally frightening circumstances, uncertainty, lack of knowledge, training, or the experience to make these informed decisions. This creates a barrier between the medical team and the patient and their loved one. Adding to the problem is the fact that the patient and family are under tremendous stress and will probably not be functioning at their best. Tempers can flare. Emotions can be high. Anxiety is often present. Disagreement among family and even the team may cause dysfunction. And to this, the unfamiliar medical language can be so confusing. The tubes, the procedures, and the sterile environment, all this can be quite intimidating. Yet the chaplain can bring calm in the middle of the storm and serve as a bridge between patient, family, and staff. The chaplain can translate unfamiliar medical jargon into something the patient might better understand so they can process it. Often, professional medical staff and doctors are lacking in the kind of bedside manner that produces a calm and peaceful environment that helps the patient process the information. Now, the staff probably knows from a medical standpoint what is best for the patient and also what has the highest chance of successful outcome. What they know and what the patient hears and feels are often disconnected. And so, if you plan to serve as a chaplain in a clinical setting, you must become familiar with the jargon so that you can translate it into layman's terms for the patient while ushering in a calm, trusted, loving, and encouraging presence that helps them make appropriate decisions. But this important skill of goal clarification is not limited to medical settings. In every chaplain setting, you will need to learn how to help someone clarify their goals and make decisions that will lead them forward to a positive outcome. What would a positive outcome look like in your setting? It is so important for us to encourage patients to engage about their wishes and help them communicate those wishes to family and someone they trust and love. Who will carry out their wishes for them if they become unable to do so themselves? When facing end-of-life issues, a conference between the family and physician are often scheduled. However, because of the overbooked schedule of doctors, they often fail to attend these while leaving it up to the staff to conduct a discussion. The purpose of the conference is to deliberate with key people in order to help them understand the choices they need to make and the recommendations of the staff. It should always be helpful for the chaplain to participate in these conferences. This is why group communication is so vital to our job. In such groups, you will find a primary caregiver and a primary decision maker. These are not necessarily the same person, and conflict can exist between them. They may be facing great uncertainty and inability to make decisions because of conflicting opinions from other family members. Then there is the family spokesperson, who does most of the talking, but may not be authorized to make decisions. You will probably encounter the out-of-towner who swoops in unexpectedly and disrupts the progress you may have achieved. And there often exists a member of the family who knows what the patient's wishes are better than what was stated in the written or verbal communication of the patient. Sometimes this person believes they know better than the decision maker, who may definitely think differently. And then there is the self-designated protector of the patient. You may also have to deal with a family member who is hurting and vulnerable and who should be treated as a person you also need to assist. In the middle of all this is the medical expert trying to get them to make a decision. This is definitely a recipe for conflict, to say the least. Should their pastor or religious leader be included in the meeting? Does the family speak English? How can misunderstandings be avoided? Where should the meeting take place? How might you create a safe environment for such conversations with as little distractions as possible? As the staff tries to explain things to the family, the chaplain should feel free to ask clarifying questions, then paraphrase and repeat the answer to the family to assess their understanding. And then you should follow up with the family with as many meetings and contacts as necessary to help them make decisions. They will look to you for the pastoral care they need. If you spend adequate time with them, you will take care of them in an amazing way. And this creates a real challenge to your schedule. In many clinical settings, the best you can achieve is a one-off 10 to 15 minute encounter with a patient. Often there are so many people for you to see that it becomes challenging to spend the quality time needed to help people in need. And as this happens to you, you will now begin to understand why so many doctors are abrupt and seem to have a poor bedside manner. It will be up to you to find a way to focus on the people who need you most. Let God guide you here. Your job will be like the young man walking along the beach near the ocean. There are thousands of starfish stranded on the beach and they're dying. He reached down to pick one up and throws it back in the sea to save its life. He keeps doing so as he walks. A man approaches him and says, "Look at how many of these starfish are there. How can you feel that you are making any difference at all?" The young man, without saying a word, simply reached down, picked up a starfish, and threw it back in the sea. Then he looked at the other man and said, "Well, sir, it made a difference for that one." You will find yourself quickly in over your head in this work. It will be important to learn limitations and to provide appropriate boundaries and find a way to practice the ministry of presence with the folks you can actually help. Be available. Become an excellent communicator. Don't prescribe answers. Listen. Ask questions. Help them come to the decisions that only they can make. Now let's consider the ABCDE approach of Rabo and McPhee. A, advanced preparation. Find out what the patient already knows and understands. How are they coping with it? Arrange for supportive family and people in their faith community. Arrange a time for an undisturbed conversation. Prepare yourself emotionally and use meditation to calm yourself. Think in advance about specific words or phrases to use. Practice delivering the news while on the way to the meeting. B, build a therapeutic environment. Arrange for a quiet, peaceful place that eliminates interruptions. Provide adequate, comfortable seating for all. Sit close enough to touch as appropriate. Provide reassurance about pain, suffering, and abandonment. C. Communicate well. Be direct and clear, but kind. Do not use jargon or euphemisms or language specific to your own faith tradition. Say words like cancer or death and dying. Allow for periods of silence. Use touch appropriately. Ask the patient and others present to repeat their understanding of the news. Arrange additional meetings as needed, and use repetition and written explanations. D. Deal with patient and family reactions. Assess the reaction as part of your spiritual assessment. What were their physiological responses? Fight or flight? Denial, blame, disbelief, or acceptance? Help them work through anger, fear, anxiety, helplessness, shame, sadness, anticipatory grief, and the like. Listen actively and explore feelings and express empathy. E. Encourage and validate. As you reflect back on their emotions, help to correct distortions or misunderstandings. Offer to tell others the news on their behalf. Evaluate the effects of the news. Explore what the news means to the patient and family. Address further needs and determine immediate and near-term plans. Make appropriate referrals for support. Provide written materials. Arrange follow-up. And be sure to process through your own feelings and responses to this situation. In every encounter with people who are in crisis, always prioritize, practice, and prepare. Assess the patient's understanding, determine patient preferences, present information, provide emotional support, discuss options for the future, offer additional support, and consider individual preferences. In a busy environment with many people to see, it is the additional support that becomes a challenge. Wow, that's a lot. Finally, this conflict resolution is part of the territory for chaplains. You will encounter conflict, and it is imperative that you learn to listen without contributing to the stress and conflict that exists. There will be crucial confrontations that you must learn how to do, and you must also learn how to contribute to nonviolent communication and how to de-escalate conflict using words that bring calm. These are skills of chaplaincy that must be practiced to learn. Most of all, I encourage and exhort you to always be an instrument of God's peace.